Okay, I think we can go ahead and kick things off. Great to see everybody. By way of introduction, my name is James Dalton. I lead business development at Alpha Sophia, and we're really excited to present a live webinar today led by Kathryn and Isabel, who will give their own introductions quite shortly. Today we'll be focusing on kind of the holistic process of moving from just HCP identification and into actually making that actionable and activating folks and kind of going through that entire life cycle and leveraging the expertise in terms of data that we have at Alpha Sophia, as well as kind of the activation expertise that Connexio has. So we're really excited to present that topic today. Like I said, I'm James, but Kathryn and Isabel will be leading the majority of our conversation today. So I'm excited to turn it over to them to lead things off.
Mhm. Great. Hi, everyone. I'm Kathryn Kellam. I am the Chief Operations Officer here at Connexio Health and have been working for the last 26 years helping manufacturers, medical device, pharmaceutical, and diagnostics connect with healthcare professionals for their products and initiatives. And so happy to be here today and speaking on the topic. Isabel?
Awesome. Hi, I'm Isabel Wellbery. I'm one of the founders of Alpha Sophia. We are a commercial intelligence company for the life sciences. We work with medical device manufacturers, pharmaceutical companies, and actually a whole array of other life science players to identify the healthcare providers that they're looking for. We draw from many different data sources to accomplish that. Really excited for this session because actually the now what question is one that I get every day. So I'm really excited to talk about this, ask questions, answer questions on what do we do to get the attention of those healthcare providers once we've identified them, and what are some best practices in this particular moment. So maybe one quick housekeeping thing. There is a chat, so if anybody wants to post in the chat, James is going to keep an eye on it. But of course, we can also raise a hand or just start speaking. So we'll keep it really conversational and dynamic to, yeah, gather and benefit from all the insight in this room today. So maybe I'll take us one step forward here. All right. So this really quick, and Kathryn, I don't know if you want to go into a specific detail, but this is really an overview of what we'll cover in this session, right? Building an ICP for targeting, but also why superficial targeting is just not working in this day and age. And then we have a lot around data into activation. So the big omnichannel question, how to best structure multi-touch HCP campaigns that will actually convert. And something I'm really excited about, some Connexio case studies from real examples, right? So not just relying on the anecdote or something that we think might work, but real examples from the healthcare industry, from real manufacturers, tried and true. And let me go. So I'm going to go into my first slide here, and I want to take a little bit of a step back. I said that this is a really exciting question for me. We have over 100 customers all over the life sciences. And the one thing that we hear from our customers, but also from the healthcare providers that we speak to, is that they are absolutely inundated with content, with folks reaching out, right? There's some alarming statistics in here, but I think all of us know that getting the attention of healthcare providers is sort of the billion-dollar question in healthcare. And I think it's becoming more and more complex as we have more channels, but also as things like AI are speeding up content production. And we want our clinicians to focus on providing the best care, but we also have to balance with the reality that they're just being inundated from all sides and still want to find ways to stand out here. So that's sort of the why now and why I think this is such an important question that we'll talk about throughout this session. I do want to share a little bit of the Alpha Sophia perspective when it comes to, oh, there's a little spelling error, but I do want to look from when it comes to building best practice audiences, because of course, before we can start activating the right providers, we do need to find the right ones. And specificity and personalization are what I've seen to work best and something that's easily neglected. So often we'll speak to clients and they think they have a very specific audience in mind, a very crisp ICP, but that is not actually the case. And I always like to lead with this example. So I'll speak to a manufacturer and they'll say, who are you after? And they say, well, orthopedic surgeons. And that might sound, if you're thinking about women versus men, things like that, like a very specific segment. But in fact, orthopedic surgeons, even within that group, there are just such vast differences, right? And we like to use this image in Alpha Sophia, and really I could have orthopedic surgeon A, B, C, D to show just how many archetypes live within that specialty bracket, right? One orthopedic surgeon who's focused on only one procedure, owns their own ASC, is extremely ambitious, late 30s, is very different than, for example, orthopedic surgeon B, who's focusing now primarily on publishing and teaching, working with academic medical centers, perhaps a different generation, already has deep relationships with manufacturers. These are very different orthopedic surgeons, but unfortunately, when it comes to healthcare targeting and activation, most folks are still viewing or painting everyone with the same brush. So the same campaign would go out to orthopedic surgeon A and orthopedic surgeon B. And as you can probably imagine, the relevance there and the personalization is really lacking because we're starting with too broad of a category, right? So, and we want to focus on the activation part, but I do want to share just a couple sort of key points that we've found to really help building those crisp ICP groups here at Alpha Sophia, again, across different life science use cases. The first one that I want to mention, and this is something I really stressed also in the example before, is demographic indicators still matter within an HCP audience. You're still speaking to people of different generations. Think of this as you choose the channels that you're going after, right? The kind of messaging. Number two, segmenting based on specialty is helpful, but it's just not enough. We're very active in sort of preaching around really pulling procedure activity, but also trend data when it comes to targeting. Is somebody just an orthopedic surgeon, or are they actually increasing and building on the codes or diagnoses that are relevant for your use case? You should have a very clear understanding of that before you try competing for their attention. The third thing that I really see our customers do well when they personalize every touch point. It's very easy to say we only personalize the field rep interaction, but there are a lot of other touch points that will exist with your brand, and there's great opportunity to also personalize those. Fourth thing, this is something that we have built into our product, and I'm a really strong advocate. Before you paint an imaginary ICP on the wall, look at who is currently successful with your product or a competitor's product, right? You can analyze existing cohorts with tools like ours. There might be other options as well, but look deeply at who you already know and then identify the pattern to define who you want to go after moving forward, right? So sort of starting with an internal analysis, I've seen really change the game when it comes to defining that audience. And then number 5, this is probably one of the most underutilized points. Like in every other domain, network selling, network marketing is a really big piece. Who do you know who knows the physician that you're interested in, right? Which clinical network exists? Who is co-authoring publications together? Who is working side by side? Leveraging those networks in your outreach and understanding the cluster that you operate within is really going to make a big difference and gives you new communication channels and angles that very few other people can tap into because they don't have the same network view that you perhaps do, starting with who you know and then branching out from there. Okay. So just a couple of tips I wanted to share. Let me pause for a moment. Any questions on this so far? Anything to share? Any anecdotes around this?
No, I would just add, Isabel, the lookalike analysis to
Hmm.
your current prescribers, your current customer base is
Yeah.
really important to understand the existing trends as a starting point for acquisition of new providers for your
Mhm.
product. So
Mhm.
that's a great tool.
So, see, I think we have a question in the chat. James, maybe you could take a look on that.
Yeah, definitely. So from Ben, the question is, there's obviously a trade-off between audience granularity and audience size. What are some of
Mm,
the best practices for building effective provider audiences while maintaining sufficient scale?
yeah, I think this is a great question. Um, of course, we all want to have scale in the marketing that we do. And Kathryn, I want to hear your take on this in a moment, right? Of course, if we only have to run a couple of campaigns, we'll feel like we've reached more folks. But I think that starting as specific as possible and then growing from there is actually the better approach. So having the courage in a way to have a very narrow audience to begin with. That could be a handful of providers that you want to get in front of initially, and then rolling out from there is going to allow you to also learn as you go. So I would always advocate to start small, leverage those networks before you go into national campaign mode. Of course, there's a time and a place and perhaps a channel for some of those bigger, low touch brand initiatives, but I do think the power is in knowing exactly who you want to go after and having a reason based on data why they're relevant, rather than a large cohort of 20,000 providers that you don't really know that much about beyond some superficial criteria. But Kathryn, maybe you can also speak to this.
Yeah, I think that is a strategy that we've seen work really well with a lot of the companies that we've partnered with. Oftentimes, we're doing a proof of concept pilot, initially selecting some of the top deciles or geographies where we think opportunity exists. Sometimes that's driven based on reimbursement and Medicaid and different states or payers that exist, but developing a pilot that we can measure for a period of 3 to 6 months what the outcomes of that initiative is, and then be able to optimize before we go broad scale. And
Mhm.
that really also helps to, conserve dollars and wasted spend is really, building that proof case of the strategy that makes the most sense for that particular product or market segment that you're going after.
Yeah, I like this concept of a pilot a lot. If we think back to that orthopedic surgeon slide that I was showing, I've spoken to providers who are burned by a brand because they have just gotten bad advertising from them or bad marketing that didn't fit them. And that's the first touch that they remember most. This didn't seem right. This seemed misaligned. So even later, when a more meaningful interaction reaches them, they'll might be less willing to listen and less open, and have a different view of that company or brand. So I like the idea of starting small, cautiously, and then learning as you go. Um, nice. All right, well, let's move forward from the building of the audience to Kathryn's going to talk a little bit about the touches. And this is such a common question.
Thank you, Isabel. As we talked through in that pilot proof of concept example, there are millions of healthcare providers. There are tens of thousands of healthcare facilities for any given product. And as we are partnering with manufacturers, and over our 26-year history, we have, much like you, over 100 customers that we've built this process for and implemented this strategy. And we'll share a little bit of background on how we've structured that and the key components of developing that activation strategy. But we're very fortunate in healthcare to have sources like Alpha Sophia that bring in a lot of data and information around the providers and access to some of the claims data and information about the procedures that they're doing and being able to dig into it. In some other market segments, that data is not readily available. And so this is allowing us a strategy where we can go after a broader look, but also helping to address essentially there's an economic impossibility. I think years ago, everybody would say everything lands on the back of the sales rep, right? You have to have
Mhm.
that territory person. But the model's really changed over the last 26 years that I've worked in healthcare. And we have to change and be able to provide information to providers in the areas that they're looking for and adapt that strategy that helps to provide a more cost-effective approach of education of the providers on your product and your value proposition. So we'll talk more about that today. And on the next slide, we, talk and look at, sources like McKinsey, who, that data has been out there, respected source, 8 to 12 touches before someone is willing to buy. And that's all something we've all had that person that connects with you on LinkedIn and, immediately goes in to sell. Well, you're not likely to buy. I'm not likely to buy on one interaction or one touch point with someone. Really needing to build that repeated touch point, build a rapport and a relationship, and the trust that you're getting from those interactions with someone. Most people in the sales process are doing their research ahead of time. They've already looked at your clinical data and whether or not you have economic and financial outcomes for the product, looking at the impact to the patient, or maybe it's a savings of time. And so your messaging that's out there across all of these multiple channels, they're going to consume 3 to 5 pieces of information before they're engaging in conversations on a sales proposal. And so we'll take this information and, on the next slide, talk a little bit more about the details of the touches on the front end. With the marketing rule of 7, I think my whole career in healthcare and sales and marketing, that's been something that we've talked about. And don't get hung up on what the icons are, because they may be different for each cohort. Different market segments like different tool sets. We have some areas where direct mail, it's so old, it's new again, right? And now you can track it because you have QR codes. We've been really successful in the practice environment of sending out direct mail and having that be something that's in the office on the provider's desk, that when we're making a phone call and they've seen our email, they're now more receptive to a conversation because they understand that there's a value that we're able to bring to them in that piece. And sometimes it's not a phone call. Sometimes it's a rep that goes in, right? And so by no means is this all a virtual activity, but it's that first few interactions that really just spark curiosity, but leading to get, into that sales conversation is really where you need to drive those additional interactions. And across these touch points, you have to really be talking about, and we don't have a slide in here to talk about the messaging that matters to them, right? But it's, the pain point for them, it's typically clinical, right? How are we going to help the patients? What are your outcomes? Do you have efficacy? Is this product safe? Is there an economic or financial impact for the facility or for the patient? Is there reimbursement for the product? But really just kind of stepping them through the value that your product provides. Yes, I have this great product. You don't want them to say, so what, right? There, in a lot of cases, you have a direct competitor, sometimes not. What's your value proposition versus that or the existing component that they have? And when you're trying to change how a physician practices medicine, and a lot of these opportunities, you are having them rethink that strategy. It's really important that your messages are including those types of things that help educate them up front on why it's important to go through. So on the next slide, we'll break
Actually, Kathryn, can I
into,
throw in a question
yes,
here? Because there's
of
something I'm
course.
very curious about. So you spoke about sort of in the 26 years that you've been in healthcare, that it's changed away from all responsibilities solely on the rep. When a rep goes into an office now, what kind of steps and touch points should have preceded that first interaction, if any? What are your thoughts on that, or what have you seen there?
Well, so obviously it's changed a lot in the post-COVID environment, right? We
Hmm.
ended up having almost all of the field reps be virtual reps, and so
Hmm.
we as a company focus more on the virtual account management side of the business and helping to address white space where it's not cost effective or long tail where it's not cost effective for those field reps. But the rules really still apply
Hmm.
when they're going into the office, if you don't have brand awareness or you don't have, at least awareness of the company, think about J&J. I go in, I sell a product from J&J. You think about trust, right? I trust the
Sure.
products from J&J or from Bosch Health or from those other companies. But I've got, startup company over here that no one's ever heard of before. And, to really be effective in that first interaction with them, you should be warming that
Mm.
target with at least these first three touch points to
Hmm.
get a better output on that visit.
Hmm. Hmm. Do you think to get, as a startup, to get that brand recall, it's about repetition, or is it also about standing out in those early touch points?
Really both. I
Hmm.
mean, offering them, something of value that, oftentimes we have a tendency to always talk about our product
Hmm.
and bring in product related information. We should be looking at our strategy from a messaging perspective, and we could probably do a whole other webinar just on that topic around like what are the other things of value to them. So on the hospital side, maybe we talk about hospital acquired pressure injuries and best practices for preventing those. It may or may not talk specifically about my product, but it's a space that I'm in. But as a consumer of information, I'm like, hey, that's really important. We had one client where they were targeting nephrologists, and it was around a specific genetic condition that doesn't have a lot of awareness. And so, yes, we could talk about diagnostic testing, or we could talk about the fact that, there's some other treatment options that are coming. But really, we were educating them on why it's important to diagnose their patients with this genetic condition to help them improve the quality of their lives. And those things are really different from a provider's perspective because they're all trying to help us, right? They're in the business
Yep.
of longevity.
Yep.
They want us to, continue to receive our treatment and hopefully live longer than we lived 26 years ago, right? So it's definitely evolved as we've gone through. I think there
Hmm.
was a question in the chat that popped up.
Yes. James, can you get that?
Yep. Sorry, I was just trying to let you wrap up there. Yeah, so question from Eric. So when partnering with a client existing field sales team, where do you typically see the best traction? And secondarily, what have you found to be the key to getting field reps engaged and invested in the partnership?
Hmm.
Great question. Thank you for that. We have run programs where we've worked, on our own, servicing the long tail white space customers and not in collaboration with the field. And then we've had some of the larger metro areas or geographies. Oftentimes, the best strategy is a partnership model with our field counterparts and really augmenting the field sales organization. That's where we've seen, in one of our case studies, we looked at, where we managed those white space long tail, same market. It was a declining market, post-COVID, respiratory, and, obviously respiratory was really big during COVID. So we were fighting to maintain that level of share, and we were able to achieve baseline in a declining market in a fully virtual white space program. But in partnership with the field sales organization, they saw 41% growth within that same time period, and gained better traction than just the field on their own. And so it's that sweet spot of really partnering your virtual team and your marketing programs. It's just important to have that level of collaboration between the two groups to make sure you have a cohesive customer experience and you're providing the best value to them, and handoffs and communications are clear in how that works. I hope that answered your question, but feel free to follow up after the webinar today and be happy to discuss that further.
Yeah. I maybe have one question, just in your experience in working with, over 100 manufacturers, do you typically see that field reps are aware and have read and engaged with the other marketing materials? Or is that something that we always need to think about and maybe push more because it's different departments and they're operating on their own? What's your sort of experience there, from what you've seen?
I would say the experience is all over the map. The best practice is really to, share that information across the board and drive awareness. When we've run programs and we're connected with the field organization and we were able to share with them, these are the campaigns that we're running. This is the messaging that's being delivered in those. And we also participated in things like national sales meetings or brought the groups together, having them be having like a virtual approach or the marketing approach all be standalone entities, but never integrating them with the sales organization isn't as fruitful as
Yep.
that collaboration experience. So whether you're doing it internally or using an outsourced partner like Connexio, it's important to make sure that those things are being communicated throughout the organization. And most of the companies, well-established companies, are doing that very well with their, product marketing teams and have that strategy in place
Yep.
today.
Awesome.
Great. So we'll talk a little bit on the next slide if there's no more questions there around really how we pull that together and kind of how we take that 8 to 12 touches and the rule of 7 and really where that applies in a sales journey. And because at the end of the day, when we say activation, we really mean we don't just want somebody that looks at our email, right? We want to activate revenue and we want to activate new customers and we want to drive demand and utilization for the products that we're developing these solutions for. And so as we looked earlier, those first 3 touches are really driving the awareness of your brand, awareness of the product. Don't get hung up on the tactics that are listed here. Right, but it could be social, could be direct mail, might be a blog post. We're doing all sorts of different channels. We have newsletters, we have brief podcasts on the subject. Everybody consumes information differently. And so having a variety of channels where you can go and access information from a landing page, or you can request, as you get into the consideration side, now you're getting people that are participating in webinars like this, or maybe they've signed up for a one-on-one product demonstration or an in-service on your product. That's very typical within our sales pros. Many of the consideration might also be a free product evaluation and having specific offers and calls to action that help to drive and facilitate that consideration process. And as we know in the healthcare system, you're usually having to go at this point through a value analysis committee and some due diligence. Maybe that's quicker if you're on a GPO contract and you're on a distributor and it's a product that they're already used to buying and they're just switching SKUs from somebody else to you because you have the value proposition. But that consideration phase is usually, fairly hands-on. Once we're getting through that, then we move to adoption and driving utilization, right? So we close the sale. Buying once is not success. Continuing to buy and driving utilization is where you're going to see the most value out of these. And I have a client who affectionately calls those bluebirds, right? They bought once because you convinced them to buy it. I'm sure almost everybody here has bought something once on social media because the ads were really good and you're like, oh. And then I'm looking at it and saying, why did I buy that again? Right?
Yep.
And I'm not going to reorder. They make their money on me reordering, right? But I stopped my mushroom coffee subscription because I don't know. I didn't get the effect that it said I was going to get, right? And so many of our customers that we're selling these healthcare, we have to drive that utilization. We have to be in front of them to continue to validate the decision that they made and make sure some of these products have, nuances to how they apply them on a patient. Make sure that they're doing that correctly and supporting that onboarding and the first patient experience so that they get the outcomes that they're hoping to achieve. And that's really the key in having a longer term strategy with multiple touch points here. Any questions there or things you want me to, or we could move to the slide and kind of wrap up that
Yeah, I
concept.
I have a question, Kathryn. This is really interesting. And one thing you mentioned earlier that kind of jumped out to me, in addition to actually executing on these phases, is also the measurement component of it.
Yes.
And obviously, in the rule of seven, there were a bunch of different modalities that you could reach out. I'd be curious to know if this is a pretty hard and fast, 8 to 12 steps before you see adoption, or how are you measuring it to know when clients are really ready to have that conversation, when they've moved from awareness to consideration or adoption? And does it ever happen faster than 8 to 12 steps?
I mean, much like everything, they're kind of averages across, and so you are going to have some quick adopters. Maybe you have a product. We think about like AI, right? And so somebody that's just coming in might be more receptive to AI, where, as Isabel mentioned, you look at the demographics of the provider, and you might need to sell differently to somebody that has been in the space for a long time, and they're just used to how they do things today. And they may require the full 8 to 12 in either case, just based on those scenarios. But absolutely, we're going to have some that move faster from a timeline perspective, and some that don't require, but some that may require more from this touch point perspective. So typically, when we're looking at customers that you're doing business with today, we recommend a cadence of ongoing communication with them, because even though it's a facility that knows your product and they may be using them, they all experience turnover. And a new nurse might need training. And we often find, in a dental practice, they're using our product until the hygienist leaves. And that's the only hygienist that does that type of, and the new hygienist wasn't experienced with the brand. And so, you can't just assume they buy from me and that they're going to continue to buy. And so having that ongoing journey, and then looking at that point that, the value of that customer. So first you start the adoption, but then you also have to keep it. So it is an ongoing, it's not like you get to 12 and stop. But that's a great question. No clear answer. But I think the data from McKinsey and all of the other marketing sources that are out there are all fairly consistent with getting you to that first adoption journey. But then from there, that's going to be up to your sales organization and your marketing team to continue to measure the sales and watch the performance, looking at whether or not you have, growing customers, you have lost customers, you have ones that look like they're declining. Those are all signals that you need to be looking at in your data, and then reacting accordingly and taking those cohorts and putting them through a different strategy of touch points.
Mm-hmm. Yeah.
Great question.
Awesome.
So if we go on to the next slide, just kind of wrapping up the, from that background and looking at the case study that we have. So this is just an example of a company that we worked with for a long-term relationship and partnership. It was in the medical device space. And, these numbers here are anonymized. They're not like actual, but it's just really to depict that because of the, confidentiality. But they were in the wound care space, working in the post-acute market, very fragmented, as those that work in post-acute and handle transitions from acute to post-acute are aware. And we were managing those long tail customers, geographies. So in these scenarios, we didn't have field representation. We were using virtual account management. We were doing support of transitions from the hospital into the post-acute space. We were doing virtual clinical education with a trained wound care clinician that could help you with a patient that's coming in and you don't know how to address that problem with the product. And so there were lots of different interactions. But what we saw there, measuring their performance, and we did a study over a 3-year period, that the sweet spot for driving orders and growth in orders. So first you have to maintain them. Second, obviously we want to grow that number, right? Was really having 3 or 4 different marketing channels. And we put some examples on here. By no means is this all representative of everything that you could do or what was done at the time, but they were receiving emails, they were getting periodic direct mail, had access to education, and really having those 3 to 4 different channels working together is where we saw the most value from an incremental order perspective. So this is something we've seen across multiple clients, multiple, care settings, just, within pharmaceutical, medical device. It really holds true that you're somewhere in that sweet spot. So email only from a outside of your field rep is not gonna cut it.
Yeah, unfortunately, it's tougher than that.
Yes.
I actually had a question from a client earlier today, and they said, how do we choose which channels to start with? Do you have any advice? I know it's gonna have to be multiple, but there's just so many different channels out there. Is there a no-brainer channel, something you must have? Any ones that are synergistic with each other? How do they choose where to begin? Because obviously building up 3 to 4 channels is just gonna be a process, right?
Absolutely. And I think the first thing I would ask is what data is available and
Mhm.
where are those targets currently? And do you have email addresses for them? Do you have valid addresses or phone numbers? Is this an audience that is typically on social media? There are certain physician specialties that like to go on X. There are others that do not. There are some that are on different types of facilities that are on LinkedIn. Others are not. So it's really different based on those scenarios. So we typically evaluate what the audience is, the availability of the data. Very common that we have. I don't often recommend that you send direct mail into a hospital because I don't
Mm.
think that it's going to get delivered. But I do think direct mail in a practice setting is a tool that can work really well. Strategic direct mail in a hospital does work, but you have to know who you're sending it to. You can't just do broad-based at the beginning. So sometimes it's the time that you're using that tactic that also changes based on where you are in the sales process and whether or not you've had a conversation.
Mhm. Mhm.
I think there's a question in the chat.
Yeah, so the question here is, were there any built-in signals that drove the success?
So on this particular study, we worked with our client and looked at whether or not, there was a product being used in the hospital setting. And, based on that discharge or the length of stay or average length of therapy, we would start then to transition and work through the setting to get them into post-acute to make sure we maintain the continuum of care. I already mentioned the example of, you get you have a signal that the sales are declining, and then we're trying to evaluate whether or not what's the cause for that. Maybe it was a new nurse, and so that is going to trigger or signal that we needed to do education, for example. And so that was an area where we needed to run that analytics and look at the sales data and understand each and every month which accounts are growing, where we see decline, what segments, which providers, and then constantly building this strategy based on those signals that we were seeing in the data. You
Awesome.
can't just set it and forget it. It's
And
definitely a working, optimizing, constantly optimizing. And these things changed over time. Like a new competitor comes in and they have different pricing or they've added a new value proposition, and having to adjust even based on those external signals was important as well.
Awesome. Thanks, Kathryn. And one more quick question here. I am really interested in this kind of sweet spot of 3 to 4 channels. And I'm curious if that is more of a diminishing returns, meaning like you just don't see as much awareness being driven or as much consideration happening if you go beyond that. So it's not worth the time. Or do you actually start to see an adverse effect where people get annoyed and it kind of turns them away from the product that you're messaging about?
Yeah, so what we saw, looking at 5, 6 different channels, is it really just flattened out. And the value and the cost benefit of continuing to expand was less as we
Mhm.
went through. And so we really selected this as a minimum. But like I said, you're always going to have people that absorb different channels. And so I think if you know that your audience is, trade shows are also a tactic that's used fairly well in healthcare, right? If you have experience in your brand that you're walking away with leads and we can develop a process through there, that may work really well just to keep your name in front of them and continue to have awareness. But we did see kind of the cost benefit analysis as you got to like 5 or 6 channels was less. And you certainly also want to just look at the engagement. So we looked at the combinations of channels and, the group that had, the virtual clinical education and the virtual account management along with the email. Those may have performed better, but the ones that got direct mail with the different combinations. So it's important to dig into where you see that traction overall, and if there's combinations of those activities that are also helping to support, maybe even at a lower level. But if they drive sales, then that's the math you have to kind of work through.
Got it. That's really interesting. And I think we had one more follow-up from M. Wagner here on the signals question, which was in response to your answer. And the question was, how often then are you updating your sequencing based on the feedback, quote unquote, from the signals?
So I think some of it is based on how often we get access to sales data or how often a company has access to sales data. If your sales are going through distribution, oftentimes, there's a delay where it might be it might take a month to get last month's sales data, and you're always kind of running behind. Ideally, you would be getting that information weekly or more frequently and more timely to be able to make those adjustments. But on a monthly basis, I would say at a minimum is what I would recommend is looking at those patterns and making adjustments so that you're always putting forth in front of your marketing channel investment and your sales channel investment the highest priority targets for them to receive an ROI.
Nice.
Great question. Thank you for that.
Awesome.
So I think we just had just to kind of wrap up one of the questions that, we were asked to kind of ponder or consider, which we've probably beat this up a little bit today, is, can you just have a single channel or why you need multi-channel? And then there's also, some studies from Acoustic in their 2025 marketing benchmark report or 2026 benchmarking report, where we have looked at it and said, from an email perspective, if those emails are really specifically timed to, a conversation that I've had with you or a follow-up with a rep, those can be very effective. And it's the those types of emails that are outperforming the single channel email going out the door, and looking at those metrics over time. And obviously, there's some changes with the iOS updates and how people look at open rates and click rates. And we all know there's spam filters on your emails. So if you're relying solely on email and then somebody gets email fatigue from just having that one channel, I'm really interested at first in the emails I get, right? And I sign up for a newsletter or I sign up for those things. And if I am either not seeing the value in it or I get busy and I don't look at those things as often, they're now going into another folder in my email and they're not getting in front of me. So there is some risk that you get that fatigue in a single channel.
Yeah.
And if that's the only way you're building brand recognition and trust, you can be ignored by your process or your prospects, excuse me.
Mhm.
So what we've seen really is tied back to the case study, the multi-channel approach and having different avenues to be in front of someone so that they're seeing them, meet them where they're at. And, there's some really good companies out there, that are doing some great work for digital and, all the things you see on like the streaming platforms now and all the targeted pieces or working with companies to put on webinars so that you're getting in front of the audience with the topics that they're most interested in. And it is a challenge to become part of the workflow for a physician and to meet their time frame.
Yeah, I think when you send out the email, even if it's the greatest email in the world, they're getting seven other emails advertising to them. So you just want to be in a couple more places to show up.
100%. And you don't want everything to be a sales message. And,
Hmm. Hmm.
when you haven't shown them value and you go straight in for like, hey, do you want to buy from me? I don't even know
Yeah.
what I'm buying. Right. And so the first thing is you got to tell me what it is that I'm buying. And you've got to convince me that I need to buy that before I'm probably going to take the time to actually meet with you. And that's the same thing, whether you're doing it in person or you're doing it virtually. You have to have that door opener.
Makes sense. Yeah. If you kind of
Right.
lead
Well,
with empathy there, then it follows that that makes sense. But it's so easy to get lost in the complexity of all those touches and really mapping it as a journey that builds over time and not getting frustrated
absolutely.
there. Okay, let me
Absolutely.
go to the
Very good.
next slide here.
Right.
Should I jump in here? Maybe just to kind of tie together, and I know we're pretty much at time, but it's great. We've had a lot of questions and I think a lot of valuable things to ponder. But the I think key message that we've tied together here in this webinar is sort of to start with the really crisp and precise data-driven ICP that then needs to be activated across multiple channels in a meaningful way, in a thoughtful, recurring, multi-touch avenue that considers really not only what we would like the healthcare provider to do, but also the reality of their situation and how we can reapproach, re-engage, and build that relationship and that brand over time, which does lead us to this omni-channel, interconnected experience approach. And Kathryn, I think you've done a wonderful job in outlining the actual tactics and also some sort of take-home points to think about, do we actually have enough touch points? And I can, even for my own company, go back and map, do we actually have enough? Is it really getting to 8 to 12, or is it more like 2 to 3? And we're just expecting too much to happen there. And then
Yep.
putting that in the context of healthcare, just how important it is to invest into all those different domains to actually get to the point of activation.
Absolutely. Yeah, especially when you're prospecting or, it's that cold outreach.
Hmm.
It's really hard. And the job that the team has to do when you have your sales organization focused on that
Hmm.
without the support of the other channels working in conjunction to support the messaging and to drive awareness, it's hard regardless, but it's even harder and harder to be successful if you don't have those other tools
Hmm.
working at the same time.
Hmm. Absolutely.
Awesome.
So maybe as a final, and we're just about at time, I'm glad we've had such a lively conversation today and so many things to come out. Recording this session, so also for people who are going to watch this later on, we do want to extend a hand. We've thrown a lot of complexity out there, and a lot of what needs to be done and all the things to consider. But of course, no one is alone in that activation journey. And so from the Alpha Sophia side, we're very happy to set up a call and, audit the audiences that you have built and talk about strategies to refine those audiences. What data can be used? What do you already know about the audiences you have? And how can you move to really seeing that total addressable market, but also the early adopter market, retaining customers, all of those data-driven pieces in your network. And then, yeah, Kathryn, maybe talk a little bit about the Connexio offer for the complimentary activation health check.
Absolutely, yes. Thank you. We would be happy to offer a review of your current, sales and marketing strategy and the targeting, understanding the markets that you are looking to go after, and utilizing what Isabel and the Alpha Sophia team have recommended from developing your ICP and looking for those opportunities to help you find hidden growth within your book of business today or the markets that you're unable to reach with your current infrastructure. So
Yeah.
happy to do that.
Wonderful. Well, whether you're viewing this in the future on a landing page and you want to reach out there, or shoot us an email or reach out to Kathryn or myself on LinkedIn, please do so. There's so many important products that we want healthcare providers to hear about and start using for the benefit of all our health. So excited to keep the conversation around activation going. And thanks so much to everyone for joining. Thank you, Kathryn. And
Thank
yeah,
you.
have a
Have a great
wonderful
day,
day.
everyone.